So yeah, I'm Sarah Dalziel, and I'm a GP in Rotorua, and I've given this slideshow presentation a couple of times to the complex chronic illness support group in the Bay of Plenty as part of their Towards Wellness course, and I guess it's about pain for people with chronic or persistent pain in general. It's not specific to people with ME/CFS, but it is, I think you'll probably find it useful, and it certainly encompasses all chronic pain and for people with ME/CFS. So do you want to, next slide? So the first thing is, we have all experienced pain, I'm sure, and I think the first thing is that pain, how we feel pain and how we respond to pain, is not the same for everybody. And if we were to recount a story of similar injuries or accidents that we'd had causing pain, we'd all relate that in quite a different way. So it's an individual, not a unique response that we each have. But what is pain? What is acute pain, and what sort of happens? So our body has a lot of sensors in its nerve endings, and these sensors respond to touch, heat, cold, pressure, vibration, and also pain. And when we experience pain, our nerve ending sensors send electrical messages through our nerves to our spine, and that transmits those electrical messages up to our brain. And then our brain reacts to that pain by activating the sympathetic nervous system. And that system is our flight or fight response, and it sends out signals back to our body, but it floods our whole body, with a chemical response to help protect us. And so it's a multi-system response. When we're in pain, our heart races, we breathe faster, maybe we get a bit sweaty, maybe we feel nauseous, as well as actually feel pain in the area that is affected. And that response helps to protect our body from danger. So do you want to move on to the next slide? So as a result of those nerves being activated, our brain sort of checks where that pain's coming from, identifies the cause, and focuses our attention on that pain, and so that we can respond accordingly. So remove your hand from the hot element, or run away from the bear that's just about to cause you pain. At the same time, our mind also has a reaction as well. So it's not just a physical response, it's an emotional response as well. And I guess that's where our unique experience of pain comes in. As soon as something happens to us, we start to think about what this means to us. So we think, oh, last time I had pain like this, I was off work for 3 weeks, and oh, what am I going to do now, because I really have to get to work next week? Or last time I was talking to a friend of mine the other day, and when they had pain in their big toe, it turned out to be cancer, and what if it's cancer for me? And we imagine all these things, and that's based on our past experiences and things like that. So we often have trigger pain memories and a feeling of fear and anxiety about pain. And there's been some quite interesting studies done that sometimes just talking about pain experiences that people have had, people say, oh yeah, now my knee's aching. Your body starts to feel the pain just when you start thinking about it. So our mind is very powerful when it comes to our pain response. Next slide. So that's acute pain. It's a sympathetic or nervous system response, along with some things that our emotions and our mind, and the response is really to try and protect ourselves from further harm, and then to promote healing. But what happens when we develop persistent pain, pain that doesn't go away, or chronic pain? And that, by definition, that's pain that continues, that carries on even when we would expect it to have finished or to have healing to have occurred. So it carries on for a long time. And essentially what happens there is that we have this ongoing nervous system response, and our pain system becomes very, very sensitive, and that in itself makes the pain more amplified. So all those nerve fibers that were set off with the original pain response are still active and hyperexcitable, and little things that wouldn't potentially normally have caused or previously have caused pain we start to interpret those as pain, and obviously that makes us more concerned and worried, and has a bit of an ongoing cycle. We can't seem to switch that pain off because it's overexcited. Next slide. So hopefully that's big enough to read. So we sort of enter this vicious cycle with pain where the pain itself increases our worries about things, how we're going to cope, how we can't do the things we did before. We worry about it, we get stressed, we maybe wonder what's going on. That can lead to affect our mood, and feeling like that we can no longer, we're not the same person that we used to be. The pain itself can cause problems with sleep, and then the stress and then the not sleeping causes increase in pain, and we might end up on medications which cause side effects. And all of these things are kind of like a cycle that amplify and continue that pain cycle. So we're trapped in this vicious cycle of pain. Next slide. So hopefully that's, as I say, it's this vicious cycle of pain. Oh, I've missed it that I was going to talk about. Oh yes, so I guess there's a good little analogy that we sometimes use that somebody else has written, which kind of helps to explain this oversensitization and over amplification of pain that we've got. And I'll just read it out to you because it sort of helps us understand that how we might still be experiencing a lot of pain when actually we're no longer, and the pain we should have healed up. So this is, imagine your body as a car and your pain system as a car alarm. When you were first injured, it was like a thief breaking into your car, which set off the car alarm. Once the thief leaves and the car alarm is reset, there is no reason for it to keep going. But what if the alarm keeps getting set off again and again and no one is breaking in? This means that the alarm is too sensitive, but it's still making the same sound, that's like the pain, as when the thief was breaking in. This is what we think happens with chronic pain. Some people's car alarm or pain system becomes oversensitive after originally being set off because the wiring of their system has become faulty. The pain system gets confused and it gets set off with things that shouldn't normally cause pain. So it's just another way of understanding things. So as we said, like we've got this oversensitized system and we need to try and dim it down, turn down the dimmer switch. And unfortunately, there might not be a quick cure for this. As I mentioned, chronic pain is something that happens over a long period of time, and it takes a long time to retrain our minds and our brains to turn that pain down. So there is no quick fix for this, but there are lots of things that we can do to manage pain. And I guess one of the main things is to try and get out of this vicious cycle of the pain running our lives rather than us being in control of the pain. Next slide, please. So I did have some slides about medication management, but I've put those at the end just for the interest of time, because unfortunately, whilst medication can be helpful, it's not really a magic bullet and does come with some difficulties such as side effects and for some medications, addiction and things like that. So to retrain our brain and turn down the dimmer switch, self-management strategies are much better. Again, it may be little writing that's hard to read, but this list is just a number of things that can be helpful. The things that are at the top, the three things at the top have been shown in studies to be the most effective things for pain, managing pain. And what you'll notice as we go through a few of these things is that these are some of the very same things that are really useful for managing chronic illness, and in particular for ME/CFS. So there's a huge amount of crossover, and if you can concentrate on a few things, then that can make a difference to being in more control. Next slide, please. So the top of the list is acceptance, really, and I guess that's about accepting the fact that you maybe have chronic pain or a chronic illness, and shifting your attention from what you can't change to what you can change. You know, if you resist this, your pain will just persist. It creates more frustration, more stress, more worry and anxiety, and so it goes on. As I say, this is not just an overnight thing that you go, oh, well, this is what I need to get on with. It's a slow adjustment to how you do things, slowly adjusting to being a slightly different person and being able to do things differently. And as I say, shifting your attention away from pain to other things, so sort of distracting yourself. And certainly one of the things that's quite useful towards acceptance is actually educating yourself about your illness or about pain, and support groups are really useful for this. Support groups, though, should be a positive and enhance how you feel about your illness with positive changes, rather than necessarily moan and groan sessions and, you know, going away feeling worse. And that's where I have a little caution about sometimes some online or social media type things. Some are really good, but sometimes you just end up in, you know, lots of negative talk, which is not very helpful, really. So just being careful if you're finding that you're feeling more negative, if you're looking things up online or whatever, then it's probably not the person for you. Next slide, please. So the second thing that's really helpful for chronic pain, and this will be very familiar hopefully to most of you, because it is one of the basic tenets of managing ME/CFS, is pacing. So pacing is also very helpful for chronic pain. And I guess this is all about planning the route and planning the refueling stops, and finding that balance between what you have to do, what you'd like to do, and then what, in the end, what is kind of for you and your body. And we all know that on a really good day, you you strive to do more and more because you feel really great, but then you maybe have a setback and takes a long time to recover. So pacing, as I say, is also very helpful for chronic pain. If you know that if you sit at your computer all day and you're going to have a headache at the end of the day or neck pain, then you need to, you know, limit how much you do and do other things. Next slide. And thirdly, particularly for pain, the thing that's also been helpful for managing mood. And Dr. Bellings did talk also about dopamine and the sort of feel-good chemical or hormone effect from that. And I guess that's all part of managing our moods. And that is, again, there's a endless list of things that everything interrelates, but medication can be helpful, but in particular other things, relaxation, mindfulness, exercise, good sleep, psychology, or CBT is cognitive behavioural therapy, positive thinking and self-compassion, because if we can feel better, we tend to focus less on pain, or it doesn't feel as bad, and can get on with other things. Next slide. Oh yeah, sorry, I changed my slides around, but I didn't send them to Angela. So just a few other things that are good for self-management. So exercise is really good for pain, but that needs to be within the boundaries of pacing. And again, particularly for ME, we know that going out there for a run to get good exercise is not necessarily going to be helpful if you're going to get post-exertional malaise. So you could replace the word exercise with activity. Part of that is also, that might just be stretching. And I guess just if you think of it on a very simple level, I know myself, if I sit down in a chair with my legs curled up under me reading a good book, maybe I get a little bit distracted reading the book. And when I stop, if I haven't moved much, like, oh, my neck's a bit stiff, I put my feet down on the floor and I've got pins and needles, and you know, you feel really stiff and it takes a little while to get going. So movement and activity is really important. Next slide. So as I say, it's really important to pace that amount of exercise we do. For ME/CFS, the types of exercises that can be more manageable are lying down or recumbent exercises, particularly if you have all the static intolerance, so dizziness, POTS, that kind of thing. Stretching is good, and things like yoga and Tai Chi, because that's often really good for your breathing and relaxation. And you know, these days we're lucky, there's lots of YouTube 10 or 15-minute yoga things, lying down on the ground. Nobody needs to, you know, you can stop it halfway through. If you can't do some of it, you just skip over it. So there's lots available. And the other part of it's not necessarily exercise, but is actually maintaining good posture. So, you know, if you always get sore wrist or hand, making sure that if you're on the computer, that you use your mouse correctly, or if you get neck pain or headaches, that you're not, that your desk set up and things like that is okay. Next slide. So the other things that, again, they all sort of tie in together for helping sleep, managing moods, helping pain, is relaxation, and we know this is helpful for pain. Breathing in particular, so there's many different ways you can learn good breathing, and I've just put a few down there of different techniques, and then also different, specific relaxation techniques. Next slide. You can also help pain with, I guess it's active relaxation or distraction. And one of the things in particular about pain is it's really hard to concentrate or focus on pain when you're doing something else. And these are good ways to relax as well. So maybe socializing with people, music, that might be listening to music or playing music, crafts, reading, just visualization, and spending time in nature or spending time outside is really, really good as well. Next slide. And the one that you've probably also heard a lot about as well, and is a whole nother talk in itself, is really good sleep. And as we've said, that pain itself can cause problems with sleep disturbance or quality sleep, but if you're not sleeping well, that does reduce your ability to cope with pain. And so again, we can promote sleep with exercise, relaxation, sometimes with medications, routines, and that kind of thing. Next slide. And then we do have, there's a number of other treatments that can be helpful for pain, obviously. Heat packs, sometimes ice, massage, other physical therapies, acupuncture, TENS, physiotherapy, and so on and so forth. So it really depends on your specific pain and what you find helpful and what you can manage. Can you flick to the last slide, Angela? You might just need to flip through them. So I just at the end, just from a GP's perspective, as to how GPs can help you with your illness, and this is not just for pain, but for everything. So I guess your GP is in a position where they hopefully over time you've developed a ongoing relationship and they know you pretty well. They know what's happened in the past, what investigations you've had done. And they can also look at the big picture of your whole sort of well-being, all of your symptoms, and put them all into a jigsaw puzzle. And I know we often talk about ME being a jigsaw puzzle, but I guess our whole health is a big jigsaw puzzle. And in particular, they're experts in evaluating pain or illness to look for important causes that might be treatable, or that might have been missed. So lots of things are diagnoses of exclusion, and things can change over time, so we can be alert to new things occurring. And alongside that, deciding on what's actually appropriate in terms of investigations. And in particular with pain, often when you've got ongoing pain, one of the things is you worry, well, what's wrong with me? What's causing this? Why is it changing? And that may just be the nature of chronic pain as opposed to something new. And sometimes going down the rabbit warren of ongoing investigations is not helpful and actually creates more anxiety and concern, and sometimes finds things that aren't important that then need to be further investigated. Doctors are experts in prescribing medication, and so your GP is really helpful to help decide what pain treatments and medication is likely to be useful for your specific pain, and potentially help to get you off medications if you're on some things that are not found to be useful. They can provide support and advice for different pain management strategies. And then because of that ongoing long-term relationship, provides support with setbacks and long-term management. From a GP's perspective, one of the things that is pretty overwhelming is when there's too much to deal with in one consultation, because we can't really do justice to too many problems all at once. And so just if you can remember that a GP appointment is generally 15 minutes long only, and if you can come to focus on one or two things at each visit, you'll probably get more out of that than overloading with a whole lot of stuff all at once. So just that's the end of my